putting AI to work. AI's impact on clinical care is affecting practice management. Everything that happens in a single practice gets amplified in a group practice. I have a single practice in Beverly Hills, but some of my friends, they may have 10 practices or 50 practices. We have some clients that have hundreds of practices. And so the scale of a small problem really gets amplified. If you have 6 practices versus 60 practices, there's a profound amplification for our group practice clients, our group practice colleagues. So let's look at the 5 benefits of AI for practices. Number 1 would be quality control. Okay, you can do audits on yourself. If you have associates or colleagues, you can audit them. So, for many people that have, let's say 5 doctors in their practice, going through and doing audits on doctors is difficult because you may spend all this time auditing Dr. Jones when he or she is the one that doesn't have the problem. Now you've just wasted all that time. What AI can do is come to you and show you which doctors aren't performing right. So who's missing things the most? Is anybody over treating or under treating or sending in insurance claims that they shouldn't be sending in? This allows you to get a quality control over your practice. Now, even if it's just you, it allows you to look back and say, oh, this is something that I missed. Let me put this on the treatment plan. Let me make sure this doesn't get out of hand. It's like having your friend on your shoulder who's a dentist saying, hey, Kyle, check out the distal of that second molar. Process automation. In dentistry, we're like a part-time everything. Part-time dentist, part-time radiologist, part-time practice owner, part-time, maintenance person. I know we've all gotten under our machines and fixed the chairs before the next patient comes in. We have so many decisions to make every day that we get decision fatigue. And so having automation happening through artificial intelligence can decrease that decision fatigue. So just small things like automatic charting, right? You take a radiograph and the AI can automatically chart in your practice management system all the existing teeth, the missing teeth, the existing restorations, if there's caries, if there's calculus, if there's bone loss, et cetera, et cetera. That saves you, a few minutes, let's say. It could also help you with probing depths. There's some programs that you can go through when you're doing a perio chart and just say the probing depth, and through natural language processing, it can listen and understand what you're saying and put it into the chart for you. So you don't have to do a few probing depths and then put it into their computer or have an assistant there. It can also automatically submit claims for insurance or payment. Office administration. This is where we've seen such a huge lift. I mean, just really big lift with a lot of our clients.